Being a lactation consultant and working with breastfeeding mothers and babies is a very rewarding career. If this is your dream, Lactation Education Resources can provide the training necessary for you to become eligible for the Lactation Consultant Certification Examination. In this video, we'll discuss Pathway 3, the pathway for those who have no previous education or experience working with breastfeeding mothers. Welcome. I'm Vergie Hughes, the Director of Lactation Education Resources. We've been training lactation consultants for over 20 years, more than 3,000 so far. Let me explain the pathways to certification and the programs that we offer to help you meet those requirements. Pathway 3 requires no previous education or experience. For people who have no medical background, this is the pathway for you. It works best for people who have some life experience. Maybe you have breastfed your own children, but it's not a requirement. There are 3 basic requirements for Pathway 3. First, there are 8 college courses and 6 general education courses required. These can be obtained locally. Second, there's a lactation-specific training, such as the courses that we offer online. And third is clinical experience. I'll talk briefly about each of these requirements. There are 8 health disciplines that are required. They can be obtained at your local community college or online from a community college in your state where you won't have to pay out-of-state tuition. Just the basic 101 version of these courses is all that's required. We have a partnership with Global Health Education who can provide all or some of these courses through Northwestern State University of Louisiana online. You can obtain details of these courses on our webpage of the IBLCE required college courses. If you've taken some of these courses previously, they do count. If you're unsure about whether your previous education will meet the IBLCE requirements, please go to the IBLCE website under Resources, then Documents, and look for the document called Health Sciences Education Guide. There are 6 general education courses that are required. Basic Life Support, or CPR, can be obtained from your local fire department, hospital, or Red Cross office. Medical documentation is included in our 90-hour online course, as is professional ethics included in our course. Medical terminology is available as an online course from Lactation Education Resources. Occupational safety and security, as well as universal safety precautions and infection control, are also available from us online. Our 90-hour Enriched course is designed to meet all of the lactation-specific training that's required for the IBLCE certification exam. Our Breastfeeding Specialist credential is available when completing this course. It's a recognition that you have completed specialized education and have an expertise in helping breastfeeding mothers and infants. It may be helpful in obtaining employment while collecting clinical practice hours. We encourage students to go to the next step and take the IBLCE certification exam as soon as you're eligible for it. This pathway requires 500 hours of clinical experience, and this experience must be directly supervised by a lactation consultant. It is best done in a busy practice setting where you can work with many breastfeeding mothers and babies each day, such as a hospital or a clinic setting. 500 hours of clinical experience is often a stumbling block for aspiring lactation consultants. Finding a setting where you can be mentored can be challenging in some areas. A formal internship program is recognized by the IBLCE to meet all of the clinical experience hours that are required, but you must plan your internship and have your plan approved by the IBLCE before you embark on your program. The hours count towards the 500 only when you're actually working with breastfeeding mothers and infants. Observation hours do not count. Clinical experience is graduated. That is, it starts with observation, progresses to doing tasks under supervision, then doing tasks independently with the supervisor nearby to ask questions and discuss situations. So you might spend many hours getting to the point that you can actually start working with mothers and infants yourself. Lactation Education Resources offers internship programs available to those in the metropolitan Washington, D.C. and Baltimore areas. Please go to the IBLCE website to obtain an application for the Pathway 3 internship. That application must be submitted to the IBLCE. If you are seeking a lactation internship and aren't sure where to start, please view our video on finding a clinical internship. Be prepared to spend some time and effort to become a competent lactation consultant. This is not training to rush through. First of all, you want to pass the certification exam the first time you try. And second, and most importantly, you want to give good advice to the mothers and babies that you care for. Being a lactation consultant is a very rewarding career. You know that you're helping moms provide the absolute best nutrition and parenting for their babies. We applaud your commitment to new mothers and their babies, and we're here to support you with excellence in lactation consultant training.